Once again. Let me welcome you for the second time on behalf of NALAS network to the series of panel discussions about the provision of solid waste management during the corona crisis. My name is Miodrag Glušević. I'm the program director for urban development, environment and communal services with the Standing Conference of Towns and Municipalities, and I'll be today's moderator. Before I go into some technical details, let me say that today's topic is going to be work safety and protection of public health and waste management workers during the corona crisis. Today we have esteemed guests from Italy. We have our colleague Florinda Eugenio. She is international relations expert coming from Rome, Italy, and she will be actually talking about some experience about the waste management provision in Italy during the corona crisis. Hello, Florinda. Then we have our colleague Istok Rozman from the Slovenian Chamber of Commerce, Chamber of Public Utility Companies. And we will also hear from him some experience from Slovenia and Slovenian cases. Welcome, Istok. And
hello,
last but not least, Dragan Lazic, waste management expert, coming from city of Bijeljina in Bosnia and Herzegovina, from the regional landfill EcoDep. He's also a member of NALAS task force for the solid waste and water management. Dragan, welcome.
Hello.
Now, just briefly about some technical details. The audience will not be able to use video and mics. This is the setting of the Zoom webinar. Only the panelists, my colleague Boran Ivanovsky from the NALAS network, who is today's co-moderator, and myself will be able to use video and microphones. You, our esteemed colleagues and guests at this event will be able to communicate with the panelists through the Q&A or chat section. You will be able, and we encourage you to post as many questions as you would like through those two options in the Zoom webinar. Very important announcement is that this event is being recorded, and by registering and connecting to it, you actually give your consent to participate in the event that is being recorded. Having said that, I want to move right away to the first the first activity for today's panel discussion, and this is the first poll question. We will have 4 poll questions today for the audience. The idea with the poll question is to bring some dynamic and include you even more into the today's discussions. And since we introduced ourselves, we want to see who is actually participating to today's webinar. And through this first question, we want to see from which institutions or organizations you are coming. The polls are very easy. Boran will bring up the poll question with the predefined answers, and we will ask you to vote. After that, we will see the results. Thanks. Thank you, Boran. For this one, you will not need too much time to respond. So I think we can continue. Boran will bring up the results in a minute. And I would just briefly, before I start with the questions to my guests today, I want to say that today's topic, the safety of workers in the public utility companies, and in general public health is a very, very important issue. It's right up there with I would say other public services like health care. And since we are in this, at least in this part of the world, we are kind of phasing out of epidemic. It is quite interesting. We are facing another quite interesting situations, I would say, that from the state of emergency and the lockdown, we are, as a society, is moving now back to new reality. And this is also bringing some uncertainties, and this is also going to be something that we might touch upon today. It is something, some experience from around Europe we might hear about today. Now, Boran, can we have the results of the first poll? Yeah. Okay. So we have variety of organizations represented this webinar. This is good to see. I hope we will have also different or variety of questions coming from the different angles. I would say. Thanks, Boran, for this. I would like to start with Florinda. I wanted to ask you, we know that Italy was the hardest hit country in Europe and first one actually to be exposed to corona crisis. So I wanted to ask you about the instructions that were given, or if they were given from the central, regional or local level to the PUCs and to the general public, and regarding behavior during the corona crisis. So could you shed some light on that?
Of course, what happened in Italy was really dramatic and nobody was prepared for that. So we did our best to face the situation, not only under the aspect of the management of solid waste, but in general, especially for public health. So really the challenge for Italy has been to make bureaucracy travel faster than coronavirus. So region, local authorities and PCUs moved and adapted as quickly as possible in order to avoid the system to collapse. So there have been different sources of information and guidelines at different levels. So of course the government, but firstly health authorities like the National Institute of Health, Ministry of Environment and so on. The above mentioned intervention mainly referred to two different aspects. The first was related to the emergency, so the management of medical waste and municipal waste in the period of possible contamination. And the second, which is connected, was related to amendments to the current regulation on waste, aimed at responding very quickly to the new situation in order to avoid gaps caused by the increase in waste. So for what concerns the first aspect, the National Institute of Health distinguished between municipal waste produced in the homes of coronavirus positive subjects. So those who were placed in isolation or in mandatory quarantines. And the second group was the municipal waste produced by the general populations. So for the first group, that was the real challenge because nobody was prepared to that. The ISS recommended that the waste was no longer sorted In addition, some regions suggested to PCUs to organize particular shifts to specifically collect this kind of waste and give them the priority to go to incinerator to be destroyed before the rest of the waste. In the case of the municipal waste, the general population, the ISS recommended not to stop the separate collection, but for precautionary purposes, tissues, masks and gloves obviously had to be disposed in unsorted waste. Those recommendations, of course, led to an increase in the quantity of unsorted waste, mainly related to the number of citizens that were subject to isolation. And it also appeared evident that in the beginning, the health indication for the COVID emergency did not coincide with what was prescribed by the current law. So it was necessary to adapt the law and to widen the legislation connected with the storage and disposal capacities. For that, the Ministry of the Environment, with the circular, has provided the regions and the provinces with the indication by suggesting the use of urgent ordinances in order to give the companies that produce and manage waste to be able to access temporary schemes and derogation from the provision, especially regarding, for instance, the increase of the maximum storage capacity of plants or increase in the maximum thermal capacity of incinerators, easy, less bureaucracy to access the landfill. So those were mainly the general indication we had in Italy.
Mm-hmm. Thanks. Any specific instructions in regard? You mentioned that the tissues, the mask, the gloves, they were disposed in the mixed bin, with the mixed waste. Any particular specific instructions in regard to that specific kind of?
Yes, of course, the ISS recommended not to manipulate, for the safety of the workers, not to manipulate anything and to allocate everything in the incinerators where possible. Alternatively, mechanical or mechanical biological treatment plants, sterilization plants, and finally, but was the last option, but I'm afraid that was the one that was mostly utilized. They went to landfill without pre-treatment, and they were confined and in separate areas that have been covered. At home, of course, the ISS recommended to, of course, to put in 2 separate bags in separate areas, and yes, to use the maximum caution with those kind of waste.
Yeah, so I would say that that would be both for the security of workers handling the waste, but also in general for the general safety and health. Yeah.
Yes.
Yeah. Thanks for this inputs. You mentioned that quantities, or at least the share of recyclables was changed. I guess this had also some impact on some other aspects of the waste management system. But yes, we're gonna come back to this in the next round of questions. Thanks very much. With this, I would like to move to Istok, and wanted to ask you about what is the actually perspective from Slovenia and experience from Slovenia, and from the Slovenian public utility companies, what was the priority given to the waste management, and how did the service contribute to the public health and safety? Can you share some experience?
Yeah, thank you. Well, at first, I think that this current COVID epidemic has shown us in Slovenia, and I suppose also in other countries, showed us without a doubt that these services which are provided by public utilities on municipal level, among them waste management, of course, are essential also for public health and safety. So these services must be provided continuously in normal circumstances, and in this crisis situation is this so more important even. We were confronted in Slovenia with an unfamiliar situation where our utilities were forced to organize quickly in such a way that the possibility of infection of workers in public utilities was minimized with different organization measures, besides, of course, use of personal protection equipment, social distancing measures, and so on. So that they were organized in such a way that if the workers would become infected, the services could be provided also in such situation. Of course, it was in Slovenia did not come to this, but we were prepared also for such a situation. I think that the perception of priority for public services has, because of this situation, has risen in local and other authorities as well in public, and that we learned a lot from this event for the possible future crisis situations, because now when we have experience, we could prepare better for other crises if they come. Hopefully not, but you never know.
Yeah, thanks. Any specific communication messages or something like in Italy about the disposal of this personal protection equipment? Anything specific?
Yes, well, of course, we from our public health authority, I wanted to talk this later, but it's okay if I talk it now, issued some recommendations or how to handle waste which comes from the COVID positive persons. So they instructed the public, not the utilities more or less, but the public, that they should put this waste in the plastic bag, then close it tightly and put it again in plastic bag, and then store it for 27 hours before dumping it into the residual waste bin. For example, the manual sorting of waste anywhere, of course, was forbidden. So all manual sorting stopped in this crisis time. Then, of course, we had measures in, for example, centers for waste and so on, that the social distancing measures, the personal protection equipment and so on. But these were more or less, you should respect the general recommendations how to handle such infection.
Yeah, we heard that the last time we had a colleague from Sweden, Thomas, was participating, and he told us that in Sweden, for example, in front of those centers, recycling centers, people were queuing like in front of supermarkets or any other shops. So that was interesting.
Well, in Slovenia, these centers were closed for some time. On the peak of the epidemic, they were closed. And when they reopened, of course, we had also, I saw, for example, in Ljubljana, long lines waiting for the. We had also some problems, of course, with waste. Our public utilities did appeal to the public that in time when these centers are closed, they should not put the waste in the nature or so on. We also, in the utilities which are handling with wastewater in the wastewater field, we noticed that a lot of personal protection equipment, for example, this mask and gloves, and so went to the toilets, not to the bins, and so some problems emerged out of this also.
Yeah, this is very interesting aspect. Okay, we might come back later to it. Yeah. Thanks for this. Now, before we move to Dragan, as the last time, I again missed to ask Boran to bring us the second poll question, which is actually about your opinion, how should the personal protective equipment that does not come from the medical institutions should be exposed. So we would like your opinion about this. You have several predefined answers. So it should be interesting to see the results. Okay, moving to Dragan now. Dragan, as I explained, works and represents the regional landfill that is actually servicing 5 municipalities in eastern Bosnia, in Herzegovina. I mean, the landfill is a specific operation on itself in the regular times, and health and safety issues are also very important during the normal times. So any changes in any or experience from this lockdown for this specific operation as a landfill is?
Well, hi Milan. Yes, you said correctly that landfill operations are specific, but as much as I could see from this discussion today and from the one 7 days before from a colleague from Sweden, I believe that all measures introduced in solid waste management sector in these countries actually are pretty similar, but only the available technologies for treatment of waste are different. And according to the available waste technologies, only that measures are different. Otherwise, protection equipment, etc., is very, very similar from one country to another. Well, our experience from this coronavirus crisis is actually that our government declared a state of emergency quite early in the stage of epidemic. So in this stage of emergency, the central government took the chain of command in their own hands. And the main advisory institution was Institute for Public Health and Safety of Citizens from Banja Luka. So I'm speaking about the Republic of Srpska. We, in some case, one hand, we had a very clear chain of command and very clear orders to follow during the crisis. And that means that we organize our work in the offices according to those instructions. And that's more or less very, very similar to previous two cases, to Slovenia and Italy, where we kept a distance, wearing gloves, masks, maintain hygiene, conduct the full disinfection of all offices once per week, supply of liquid disinfectants that for personal use, etc. But the other issue in this is organization of the sanitary landfill itself, because there we had to adapt to the new situation since there was no clear instructions how to properly organize our work. So the main consideration that we had in mind at the beginning of the pandemic was how to keep workers in social distance in order to prevent that if one of them is infected, that all crew has to go to quarantine for 14 or 28 days. So in this case, we split the workers in a few shifts, saving a few of them in case that all shifts are infected. Meaning that we had two shifts, one each day another shift. and saving few workers in the case that both of shifts are affected and quarantined, that we can temporarily hire new workers, particularly meaning drivers of compactors, bulldozers, and heavy machinery. And those saved workers should be some kind of instructors to those new employed workers during the crisis, during the absence of the permanent workers on the landfill. We were very lucky in Bijeljina, since there was only 15 confirmed cases in total in the whole period of epidemic here. So there was no need to introduce any specific measures except the one I said, but we were ready to keep our services ongoing, even in the case that all of our regular workers are infected.
Yeah, great. Just what I wanted to ask you, in regular time, what are your open hours, and did the open hours of the landfill change?
No.
Were there any instructions for the municipal companies that transport the waste, you know, in which period of time they should dispose,
we
or
are
whatever?
open from 6 to 20 hours every day, except Sunday. But there was, since amount of waste during this corona crisis slightly increased than during the regular period. But operation in the solid waste management, specifically by operation of the communal companies who collects and transport waste, were much easier than regularly, because there was no such traffic jams in the town during the rush hour. So they were more efficient in that sense, and there was no need to prolong our working hours. In the other hand, we were consider about the chain of supply, trying to assess risks of lacking some, for example, fuel or some other things that we might need for our normal operation. And there was no any kind of obstruction during the chain of supply during the corona crisis. And also, even including supply of masks, of liquids for disinfection, gloves, and other equipment that we might need. And I would just like to mention one maybe important thing for us. 2 years ago, we conducted a project together with NALAS and with GIZ, concerning, among the other things, health and safety on sanitary landfill. And that project ended last year in this period. So we used that project to fully train our workers on the landfill for safe work, and they were fully equipped for regular maintenance or regular operation with waste. In this crisis, they were only instructed to improve hygiene of the spaces, of the machinery, to avoid any physical contact with waste, and to put on a minimal level social contacts among themselves. Mm-hmm. And it worked very well.
Okay, so that's a good, I would say, example also regarding the cooperation also in the region and NALAS involvement in it. That's good to hear. Just before we move forward, if I understood you correctly, the shifts, they were, so one shift was working per day, and the shifts were, okay, changing every day. Okay, so the workers from the shifts actually didn't come in contact in any period of time to prevent, good. This was just for my clarification, and I think it's very important approach maybe for the others to hear?
To keep 4 to 5 workers per shift. And it was mainly enough for normal operation.
Okay, moving on. I have some more questions, but I will leave them for later. Moving on, at this point, I would like Boran to bring us the next polling, the results. So, yeah, I think most of the majority of answers go to this that mixed waste should this equipment should be put in mixed waste, but in a separate closed bag. This is something that we saw and heard from many instances coming as a suggestion, and it seems that it is a good one. Thank you, Boran. And can you bring us now the next poll question? Yeah. Okay. This is I would say solely about your perception, and the question is whether you agree that utilities and among them waste management are at least right behind the healthcare services in terms of importance to the public health and hygiene. Okay, moving on to the next round of questions. I wanted to ask Istok, since he's coming from the chamber that represents the public utility companies, do you know were there any official collaboration and requests from other public services like healthcare or police or any other public entities to the public utility companies, and were there some specific demands that PUCs had to carry out, any additional services that or had to provide in terms of volume, or in general, in addition to what those public utility companies anyhow provide?
Well, in Slovenia, public utilities are mostly municipal ownership, so the collaboration with local authorities is common, and this showed also in this situation. We had no very specific instructions, but when needed, the municipality and utility did collaborate and find a solution. For example, I don't know if some utility was faced with shortage of personal protection equipment. The civil protection, which is organized on the utility level, on the municipal level, did provide this equipment. The other guidelines or instructions regarding waste management, I talked a little bit earlier, came from the state level or from the National Health Authority, how to handle waste in contact with COVID patient or with suspected COVID infectee, or that it should not be the manual sorting and so on. Only official request I remember came regarding the sorting centers, or not the sorting centers, the centers when the public brings waste also, which were closed. As I said, in the peak of the epidemic, we received a request from the government, from the Ministry of Environment and Spatial Planning, that they should be reopened. At one point they decided that they should not be closed but reopened, and that the protection measures in this center should be implemented. So that's about that. No other specific.
Yeah. Any demands in terms of disinfection of public spaces? Something like
no
that?
demands. No demands. Some utilities did disinfect the public spaces, probably with agreement with the municipality, but there was no state instruction to do that. It was only instruction, not so for the utilities, but for the managers of the multi-apartment buildings. They had the instruction to disinfect all common places, for example, stairways, elevators, and so on.
Okay, thanks. Maybe this is time to see the results of the last poll. So about this seems I would say reasonable. I mean that we all agree, mostly agree that communal services, including waste management, are as important, or maybe not as important, but very important in those terms. Yeah, and this is also something that we discussed the last time about the service delivery. How the general perception is that the service delivery was uninterrupted. Looking outside, looking from the outside, but some changes as we hear, and some adaptation to the situation had to be done in the public utility companies, but also on the local level in general. At this point, before I move to Florinda again, there is a question coming up from the audience, from our colleague Sanja from Montenegro. She's wondering about whether the disposal sites, so at the landfills, whether specific areas where these COVID-related or personal protective equipment had to be disposed separate of other ways. I don't know if any of you can comment. I can see that Dragan did comment already, so Dragan, maybe you can, but the others also, please. Dragana?
Yes.
Okay, Florinda,
okay.
yeah.
Yes, of course.
Okay.
I have already mentioned that, yes, the waste coming from households where COVID positive people had to be separated in landfills. So some particular areas in landfills were designated for this specific kind of waste, and they had not to be manipulated or sorted, and of course they needed to be covered on a daily basis in order to avoid dispersion coming from this kind of waste.
Yeah, thanks. Dragan, do you want maybe to share in the...
Well, I see that, I believe that my answer written is quite sufficient, but there is no actually some specific cells in sanitary landfill. Usually you have only one cell and you have a plan or fulfillment of that cell. So you just stick to that plan, and it's actually a regular communal waste, even though that if it's infected by the coronavirus, according to the World Health Organization, it remains like 15 days top on different surfaces. So there is no actual need to build, construct, and especially dispose that waste different from the regular one.
Yeah. And did you do maybe some kind of extraordinary monitoring or analysis of waste? Did you do something like that on the landfill?
Which is monitoring of air is on a daily basis. 24/7, and monitoring of waters is on a quarter basis. So there is no need to improve, to involve any additional monitoring.
And I guess nothing unusual, you found nothing unusual during this period?
No, everything was quite normal, quite regular.
Yeah. Okay. Okay, thanks, guys. Moving on or coming back to Florinda, we opened the floor for this, let's say, unexpected outcomes for the municipalities and public utility companies regarding the change in quantities of recyclables. And so can you shed some light on that topic, Florinda?
Yes, sure. First of all, I would like to share with you some numbers regarding recycling before COVID-19. So in average, the annual production of waste in Italy is about 30.2 million tons of waste, which means about 489 kilos per person. And Italy is in a good path for what concerns the recycling with a 50% rate. So this is good. Of course, after COVID, something changed slightly regarding the rate of recycling, as you mentioned, mainly because of the lockdown. Municipal solid waste amount decreased because of many activities, especially restaurants and shops were closed. But what happened is that because of the guidelines I had mentioned before regarding the dispositive, the masks and gloves, the amount of unsorted waste increased. So this situation in the beginning creates some problems, let's say, between municipalities and regions. Some municipalities were fined because they didn't reach the minimum level of recycling. Of course, in the end, they agreed that this was and still is an extraordinary situation. So they agreed to change the tolerance level accordingly. But what is important to highlight is that the real problem has been the management, the waste managing. In fact, this is affecting the whole recycling chain with a loss in turnover, which has been estimated in about 1 billion euros for the companies that manage the specials. In fact, if the collection of waste continued somehow, the same did not happen for other parts of the chain, such as selection and recycling. Moreover, the closure of some sector that process or use recovered material, that such as some plastic, that created some blocking in the outlets and the collected materials, and that the stock saturated quickly. So for instance, the CONAI is the consortium, the Italian packaging consortium. They reported that main problem with plastics are recorded, especially with non-recyclable waste. About 60% of it was used in factories. For instance, there is the plasmics, which is derivable from non-recyclable plastic that was and is usually used in cement factories, but because those were considered not strategic for the economy at the moment, they were closed. So of course that creates some issues. For the recycled plastic, normally it is exported mainly, but exports was stopped, so that was another problem. The minimum part of recycled plastic is used in toy factories or street furniture factories, and again, those were considered not essential and were closed. So CONAI suggested some intervention to adapt to the new situation. Mainly, the suggestion was to allow the increasing of the annual storage capacity of all plants, and increasing the thermal capacity allowed, and mainly simplifying bureaucratic procedures to access to landfills. So I think the real challenge has yet to come, because we are we have just started phase 2, which means that also restaurants and shops are open again. So this will mean more waste in general, municipal solid waste, and that will be added to the waste coming from medical disposals. We have estimated that we will need about 2 million masks per month in Italy. So that will be a real challenge. Phase 2 will be a challenge.
Mm-hmm. Yeah, and what about, I mean, we discussed this earlier. Were there any, I mean, since these percentages dropped and the indicators dropped, and you as a country, as we all have some obligations to fulfill in regard to the recycling rates. Did this reflect on municipalities or in any way?
Yes, as I mentioned, we don't have official, numbers to compare. Of course, I mentioned that this 50% recycling rate. So it will be interesting to see next year the various reports what will happen, what we will see. But yes, as I mentioned, the municipality had the problem, especially in the beginning, with regions, because most of them were fined because they couldn't meet the minimum rate of recycling. And of course, the only solution at that time was to adjust the tolerance.
Yeah, that was interesting to me, that municipalities were somehow fined, but I guess this practice didn't continue. I mean, doesn't make sense, really.
Of course.
Yeah. Okay. Thanks, Florinda. Dragan, I mean, we are coming from the region which is kind of not well known for the recycling still, I would say, but we are quite well known for the existing of this specific waste pickers. This group of people is actually, not always recognized, and I have a feeling that in these circumstances, they are even more vulnerable and exposed. Do you have any experience? I'm not sure about the situation in Bijeljina, in Bosnia and Herzegovina in general, but do you have any experience to share in this regard?
Well, I don't have any direct information from the sector, since those informal sector is unrecognized officially, and that's why it's informal. Yet we can have some information from the other side, from the companies who purchase secondary raw materials, plastic, cardboard, paper, etc. And as much as I know from that source, actually this Corona crisis influenced very much this informal sector, meaning that all those purchasers of the secondary raw materials were closed for almost 2 months, for example, here in Bijeljina. And specifically ones who purchase plastic materials, since there was huge decrease of the petrol on the world market, and that increased price of the plastic on the world market, which comes down on the local level, and for this reason they stopped to purchasing plastics and such materials. And that's why waste pickers simply did not pick up the waste from containers here. And the second thing, there was a news here in media that coronavirus maintained on surfaces like plastic bottles for 2 weeks, and they were scared that could be infected, and for this reason they didn't want to do anything with the waste during the Corona crisis. And I believe that they are starting to do it something now, but previously during all those 2 or 3 months, you couldn't see any of them on the street.
Yeah. I guess this is also due to the this lockdown and restriction in the movements also. So yeah, I can imagine that this sector is very heavily hit by this situation.
Yes.
Yeah. Okay. So since we are approaching the last 10 minutes of our event, I would like to ask Boran maybe to bring up the last poll question. Thank you. So this is actually about the safety of people working and handling the waste in the company. So the question is, which risk do you consider to be the greatest for the solid waste handlers? So this one might not be so easy to answer, because we are not all close to people that are handling waste every day, but it would be interesting to see what is your perception of this question. Okay, so since we are closing to the end of the event, I wanted to ask Istok, what would be the kind of most important lessons learned from this situation that you could share with us in Slovenia? Because Slovenia is for us in Western Balkans kind of a country that we all look up to. So it would be interesting to learn from you.
Well, the most important lesson learned, I would say, for all the utilities, not only for the waste management utilities, is that we learned that we weren't prepared for such a situation. Nobody was, probably, in the world, and then we should make some preparations for such situation, and that we should think what could happen, that we would be prepared then for it. For example, we talked earlier about water safety plan, something like this, maybe for the organizational matters of the utility, that the utility can be prepared for such a crisis, that they can quickly adapt to reorganize staff shifts and so on, so that they can assure the continuous service, which is really, I think, essential. The previous question was second in line beside healthcare, but I think it's second in line, but very close to the first one, because yeah, without these services, all stops.
Yeah, thank you for this, and especially since we are preparing the next week's panel discussion, which is exactly going to be on a topic of resilience of the services and preparedness and planning, short and long-term planning for the crisis situation, but in general. So thanks for making this a link to the next panel discussion also. Dragan, any last, let's say, thoughts? Last time we heard that a lot of PUCs are facing a problem with liquidity. Is the landfill different in that respect, or you also?
Unfortunately, it's not. Unfortunately, I believe that all communal sector, not in Bosnia, but in whole region, is in position that it's fighting for liquidity, more or less, not specifically, but in some extension, yes. And it's not different in regional sanitary utility companies. however, I would remind you that 2014 there was huge floods here in Bosnia and Serbia as well, in Croatia as well too. So we managed to adapt to new situation quickly, and we managed that situation successfully. This is 6 years after that we have new emergency situation, and I believe that we passed that exam too. I would remind you that at the beginning of the corona crisis in Croatia, in Zagreb, was an earthquake. And they had emergency situation in the emergency situation. It was a double problem for them.
If you have seen
be as prepared as you should be, probably as you want to be, but you have to do quickly. And I would support what Istok said, that we in communal sector we used to do quickly and to change our daily routine in order to adapt to the new situation. And as much as I could see in the previous examples, we passed that exam very well.
Yeah, thank you. I mean, this what you mentioned about Zagreb. I mean, if you would see that kind of scenario in a movie, you would say it's a very bad movie. You know, it doesn't really happen. I mean, but it was. Yeah. Okay. Before we bring up the results of the last poll and come to the conclusion of this event, I want to ask Florinda if she can. Share any last thoughts with us on this matter. Florinda, anything specific that you want to add?
Yes, I wanted to highlight that how communication could be important in these matters. In my opinion, the communication was missing. Communication towards citizens was missing for these particular matters. In general, when a citizen looks at an item and says, I don't know what to do, what happens is that it is disposed in unsorted waste. So anytime a person says, I don't know, this is a failure for the system in general. And sometimes citizens use unsorted waste because they are lazy or they don't care, but in this specific situation, that was not the case. People were scared because they didn't know how to behave. I mean, I'm talking about daily basis. You know, for instance, grocery shopping bags. We were told to disinfect them, but people didn't know how. And so in this sense, that communication, very basic communication to population, to citizens, was missing. I mean, the government adopted a campaign to in favor of a social distancing or how to wash your hands, but I think a targeted campaign for these matters, for how to face this situation, I think that could have helped the population, and of course that would have to help the entire society.
Yeah, thank you. I mean, I think that this goes very well in line with Istok and Dragan already said, and this is also something that you need to be prepared, and the communication also needs to be prepared in advance, and should be in line with the situation that is ongoing. So. Thank you for that, Boran. Could we have results of the last poll? Yeah, this one was I would say the question that I could not foresee the responses, but we have a kind of split between two answers. The one is handling mixed municipal waste containing personal protection equipment. The other one is handling the waste from the health care facilities, which seems I would say reasonable. Thank you. And now I think we used all of our time. Any last, if you wish to if you have any last messages, please come out with them. If not, at this point, I would like to thank all of the participants for their patience and participation in this event, and especially I want to thank our panelists for excellent contribution. And I'm happy to invite you all to the next week's panel discussion about the resilience of the services. See you next week.
Thank you very much. See you.
Thank you very much.
Thank you. Thank you very much.
Bye-bye.
Bye.
Bye.